Be ready, okay?
Okay.
Okay.
Good morning. Welcome and thank you for joining us today for the meeting of the New York City Health and Hospital Capital Committee. Today's meeting is officially called to order. First, I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on February 8th, 2021. Is there any questions? If there is no question, let me ask, all in favor?
Yes.
Yes.
Anyone opposed? Hearing the motion is carried. Thank you. Now we would like to hear from Senior Vice President Ms. Flaherty about her report.
Good afternoon, Chair Kurgan and Pinimura. Thank you for allowing us one resolution to get our general construction job order contracting requirements contracts in place. Our OFD department remains engaged in our capital development, facility management, real estate, and housing work. Next month, we will have a robust capital meeting covering all aspects of our office. Our design activity on approximately 40 projects supporting our system with the new bond funding is well underway. We look forward to doing a more robust update on that portfolio of work during our May debriefing. Given that Earth Day happens this month, I wanted to let you know we're excited about our ongoing partnerships with Department of Citywide Services, New York Power Authority, and Con Ed to combat climate change by reducing our energy usage and our carbon footprint. We're excited to be kicking off a number of new energy saving projects system-wide this year, and we received additional funding for 2 energy projects from DCAS that will help us at Harlem and North Central Bronx. We're in the process of initiating those projects for the design phase. And now I'd like to move to the board resolution unless there's any questions from the committee.
Thank you. Any questions? No? Thank you. Ms. Flaherty, please continue to the resolution.
Thank you. This resolution is for authorizing the New York City Health and Hospitals Corp., the system, to execute job order contracts, JOCs, with 3 firms, Volmer Construction, Inc., BA Global, Inc., and Carefree Improvements, Inc., the contractors that were selected through the system's public bid process to provide general construction services on an as-needed basis at various facilities throughout the system, with each contract to be for a term of 2 years for an amount not to exceed $10 million for each contract for a total authorized value of $30 million. And now I'll start. So the background here is that we utilize job order contracting, known as JOCs, as construction contracts that we award based on a public competitive bid, and the bidders use a multiplier against an itemized catalog of services that cover both labor and material. The solicitation happens like any normal lump sum bid, and it's identified, and that process follows all of our OP procedures in 100-5. This allows contractors to have an established pricing model for unique specific projects, and tasks are based out of this bid with preset prices. In 2019, there were 3 general contractors awarded under the same model. Their contracts expire in June, and this resolution reflects a new award for new contractors. The proposals related to this work includes the book itself is maintained by Gordian, who helps facilitate the JOCs program, and they update the price book regularly, annually, according to New York City cost construction indices published by Engineering News Record. These contracts are deployed across all facilities, any H&H facility that general construction is needed for, any smaller scale projects and urgent projects where the scope is well defined. It allows us to move quickly into construction. Next slide. This gives you a current overview of the 3 existing vendors that were identified in the winter of 2019 and awarded with contracts executed in June of 2019. Rochelle, Carefree, and Gemco are those 3 general contractors. Their multipliers listed, as well as their current capacity of the contracts and work orders issued to date, as well as their MWBE spend Across those contracts, Rochelle is an MBE firm and Carefree also is an MBE firm. So those have very high utilizations. Gemco is at 26% utilization. And at the time of those bids, 6 firms participated in those solicitations in the winter of 2019. Next. So for this procurement, public bids were opened on 3 different days, the 24th, 25th, and 26th, as GC1, GC2, and GC3. Each of those contracts distinctly have 2-year terms, and we received bids from 17 discrete firms. GC1, the lowest bidder was Volmar Construction, and their multipliers listed there. 17 bids were submitted. Their max evaluation and passport is satisfactory, and Volmar has been a JOCS contractor for H&H, and so their user rating within our system is 96.5% across 4 facilities that they've worked on 20 projects. The next low bidder was BA Global for GC2. They had the lowest multiplier from 11 bids that were received. They have private references that have been excellent, and they are new to H&H, just recently started a project at Woodhull through another resolution that actually came to this committee a few months back. And but their track record thus far has seen as satisfactory based on the feedback we received from prior users of their services. The third low bidder under the GC3 distinct contract is Carefree Improvements, an MBE firm. Their lowest multiplier is listed. 9 bids were submitted for that. They didn't have recent MOX evaluations. Our in-house user rating for them is 87% across 4 facilities on 6 projects. We've been working closely with Carefree, and their recent performance has improved. They recently are going to be ribbon cutting and ED department at Woodhull Hospital, which was a fast-track project, and we're very happy at their performance there.
I'm sorry. So does this figure include that? The ED?
No, not
So how
yet,
much would
Sally.
that be?
That project, that was a smaller, low bit, under $5 million separate procurement that happened in the summer. And so they haven't hit the 1-year evaluation period for us to do the evaluation for them.
Okay.
So the next slide shows you the MWBE utilization plans for each firm. Volmar has a number of firms, both suppliers and performers, service providers, to have a 31% MWBE utilization plan. BA Global actually has their MBE certification pending at SBS currently. And so this utilization plan here indicates their subcontracting plan of 45% for MWBE participants. Should BA Global's MBE certification be approved by SBS, their utilization would become 100%. But today we have it listed at 45% for the reasons I already outlined. And Carefree at MBE also has electric, their subcontracting, and their MWBE utilization plan. They self-perform 60%, so their total is 70% MWBE participation. And finally, this is the resolution language itself that I read at the beginning of this presentation. We're happy to take any questions.
Thank you. Let me go through all the members. Jose, any questions?
No questions. Thank you so much, Christine.
Sally,
Thank you.
any question?
I think just the obvious question about Carefree Improvement. I always get concerned about awarding MWBE or MBE contracts and making sure that they're able to perform to the best of their ability. And now we're adding on to it. So what has been the reason for their delays? Do you know?
So, I mean, there hasn't been delays on their recent projects. we have been working closely with Carefree and mentoring and, supporting them and making sure that they succeed at the projects they work on. A user rating overall of 87% still is in the good standing across our system. They're a smaller company, and so we just have to be cognizant of their capacity and capabilities and not try to overload them with more work than they can take on, but also give them opportunities. And so there isn't a project that they're delayed. They're actually met the schedule of the recent project that we hope to do a ribbon cutting this coming spring, summer, based upon kind of the other pieces of completion happening at Woodhull. Does that answer your question, Sally?
Yeah, I mean, again, my only concern is that, as you say, too much good luck can be bad luck. You don't want to overstress them in their capacity, but if you're monitoring that, it's fine.
Yeah, and I think that's why we have these as system-wide contracts. So there's 3 options for a facility to go to. The pricing's already predetermined. This allows a vendor also to say they're a little busy on something else. It also allows us to inform the facility if we're already aware that that vendor's tapped out or busy on other projects. So we'd like to have options for the facility.
Thank you, Christine.
Thank you.
Thank you, Sally. Jose, any question?
No. Thank you.
Bob, any question?
Yes, can you hear me?
Yes.
Yeah.
Okay, thank you, Christine, for your presentation. It's very extensive and covers as many things as I would think about. I particularly want to thank you for using the H&H user rating, because this has become an issue over the years where a very common question is, well, what is your experience with this particular company within health and hospitals? And so I want to thank you for using that. It means a lot to me because I can see that means that we have experience with these companies. We see the certain percentages that tell us, the rating and evaluation given by H&H. And I want to thank you. I have no questions other than that observation.
Thank you, Bob.
Thank you.
I just have one comment, Christine. I think follow up on Sally's comment is that perhaps there is a way that you can present when you are in kind of making the introduction to this motion at the board meeting to balance both, the rating as well as the action that your team will take to ensure that these vendors deliver for the different facilities, so that you balance those out and try to answer those questions before they are raised. If there is no other questions, I would like to take a vote. Jose?
Yes.
Sally?
Yes.
Bob?
Yes.
And Feniowski also vote yes. So if that, I believe that's the only motion that you have for us, Christine?
Yes, this month.
This you tried. I like Christine. You giving us heads up that this is a light month for us. But
Clear the decks next month.
any old business we would like to discuss? Any new business? Hearing no further discussions.
Hey, Fanny,
Sorry, Sally. Yes.
on the 4 contracts that Carefree got with 6 facilities, could I just get a sense of the total of those contracts, or when you get a chance, Christine?
The total volume,
Sure.
construction volume?
The
Yeah,
total
that was-
dollar amount of the
Yeah.
projects they did.
So we'll triple check, but I believe that it ties to the capacity associated with the chart earlier on slide, sorry, slide 3.
Yeah.
Shows you the number of projects, but we'll round back on that, Sally, just so that we're fully clear, and we'll provide you a breakdown of the projects.
Okay, thank you.
But Christine, wouldn't the amount be 4 million at least up to now? The volume of construction work?
It should be. I don't want to, I need to look at the details. Also, as what came up when we talked about the Woodhull project, that doesn't have its evaluation in yet because the project is underway and it's less than a year. So there could be newer projects that they're just starting that aren't in that 6 because it's underway. So, we're not evaluating every month. We're evaluating, once a year or in tandem with completion, with full completion.
Okay. So if you can get that information to Sally, that would be good so that she are able to understand better.
Sure.
Again, any new business? No? Again, thank you, both of
Thank
you,
you.
for the
Thank you.
patience, and thank you. And with this, I would like to formally adjourn this meeting. Thank you so much.
Okay,
Thank
time
you,
to-
Jose.
Okay.
Thank you, Bob.
Take care.
Thank you,
Bye,
Sally.
everyone.
Bye-bye.
Thank you, everybody. See you soon.